We frequently have questions regarding dialectical behavioral therapy and why we use DBT in treating our clients here at New Roads. Dialectical behavioral therapy was originally designed to treat people with suicidal or para-suicidal behavior, then became very apparent that it was very helpful working with people that had borderline personality disorder. Since then, literature has shown that using components of DBT to treat people with addiction has been very, very helpful. So dialectical behavioral therapy, dialectics, is an old term from ancient Greek that refers to the finding truth by synthesizing the opposites. So by examining the two opposite sides of any issue, you can synthesize the two, and in this synthesis you find truth, which is very helpful for people that tend to be polarized, thinking things are all good or all bad, which we certainly see with many people in early recovery. So you can see right there already some utility. DBT is made up of several things. It's made up of highly trained individual therapists. It involves skills training. Skills training consists of mindfulness training, emotional management, things like that. It involves telephone consultation, so that means that the therapist can be accessed on the telephone reasonably to help clients apply the skills they've learned in real life settings and in real time. And then also just to support the clients. And then sometimes it's also used just to help people feel like they're doing a good job. So it can kind of help bolster behaviors. Another and final component that I'd like to talk about is the consultation team, and the consultation team consists of us therapists, all of those folks who are actually providing the DBT, actually working together in staffing cases. That way we are mindful and effective therapists as we're applying the techniques. Some great examples of how this can be helpful is one of the reasons that people relapse is they struggle to manage anxiety. And one of the things that DBT could teach somebody is emotional management skills. If somebody is able to learn how to use emotional management skills that they've created just for themselves with the help of their therapist and maybe a skills coach, at that moment that they're experiencing that anxiety, they can use those skills or even be coached to use those skills to manage it, and that anxiety doesn't turn into a trigger. And that's and it can be very, very helpful in that setting to as a relapse prevention technique, as an example.